This senator from Florida wants to thank his neighbor and colleague for those comments and to say that how true it is that if there's an underserved part on health care, it's not only underserved areas in the inner city, but it is clearly also in rural America. And this senator wants to thank the senator from Alabama for coming forth with that piece of legislation. I look forward to discussing it with him. I also want to thank the senator for his comments about how short-sighted it is that the government, as he stated, of his state of Alabama, and certainly the government of my state, the state of Florida, refuses to expand Medicaid and has so for almost 7 years, when in fact in the state of Florida there's almost $5 billion a year that is sitting on the shelf, that is Florida taxpayer money that is going elsewhere if not accessed, and it has not been accessed. And in my state of Florida, that is 800,000 people, almost 1 million people, poor people, disabled folks that would be getting health care that otherwise are not getting health care. And would the senator believe when, in fact, they don't have health care through Medicaid, of which they're eligible under the law, when they get sick, what do? They end up going to the emergency room, not having any preventive care. Now it's an emergency. And of course, when treated at the emergency room, the most expensive place at the most expensive time, lo and behold, it's uncompensated care, and the hospital can't eat all of that uncompensated care. What happens? All the rest of us pay by increases in our premiums. And I want to thank the senator for his statement about what has happened in my neighboring state of Alabama.
Thank you, Senator Nelson. I appreciate that. And although the numbers are not as staggering in Alabama, they are still significant for the state of Alabama with regard to Medicaid. So I appreciate your comments very much. I look forward to working with you on this bill and helping this move forward. Mr. President, I yield the floor.